When a patient presents for evaluation of the access at American Endovascular, a complete history and physical exam is performed of the patient's access. Other questions are asked about the patient's overall health. Once determined that the procedure can be performed safely as an outpatient, the patient is then brought into the operating room. The arm is then cleaned using a sterile fashion. The arm is then cleaned in a sterile fashion, and the skin is then anesthetized with lidocaine. The lidocaine can cause a pinch and a burn for a couple of seconds. Well, that will numb up the skin to allow for the angiocath, which is a small IV, to be introduced into the access, whether it's a fistula or a graft. Pictures are then taken using fluoroscopy, which is live X-ray. I inject contrast dye into the access, which flows with the blood. It will show me areas of narrowing, tortuosity, and sometimes thrombus if it's present. Once the decision has been made to perform angioplasty or stent placement for that patient, the patient will be given medication. The medication we use is fentanyl and versed typically. Fentanyl is a narcotic which helps with pain, and versed is a benzodiazepine which helps to relax the patient. The patient will not be knocked out completely because overall the patient's procedure can be performed relatively quickly, and I would like to have the patient to have complete control over their breathing and to ensure that the blood pressure does not drop. A typical procedure for maintenance requiring angioplasty or stent placement can take approximately 15 to 30 minutes. A more complicated procedure, if it's a thrombectomy or a maturation of a fistula or a graft, may take a little longer, perhaps 30 minutes to 1 hour. After the procedure, the patient will be brought to the post-operative area where they will be monitored to make sure that there are no complications and to ensure that they're able to get up and walk out of the office on their own.